Hi, good evening, everyone. We'll be starting in like 1 minute. We just want some other people to join us. Good evening, Mr. Uche. Good evening. Can everyone hear me, please? Mr. Uche, I don't know if you can hear me.
I can hear you.
Okay. Thank you, sir. We are very happy to have you here. Okay, so it's 5 o'clock. Good evening. Before I introduce our guests, I would just like to talk to us about health facts. So this is like our 4th edition of HF Live in Health Facts, and today's topic is let's talk about health insurance. We've had different series. We've done let's talk about infertility. We've done let's talk about assisted reproduction. Let's talk about depression, and today we want to talk about health insurance. So health facts is health information media where we give out information that can help people to improve their health and to live healthy lives generally. Our target audience is Nigerians and Africans all around the world, and we are just trying to give out information that can really help people to live healthy lives up to the best, actually. So that's what we're trying to do here. So this event here that we organize every month, we bring experts on here to talk to people, answer your questions, to clear doubts about anything you have, any misinformation that you might have heard before. We are here to clear the doubts, to just give you the right information about things. And today's topic is actually very crucial, which is health insurance, because not a lot of people actually have access to information about health insurance. They don't even know what they are supposed to do, what should be done if they want to, secure health insurance. That is why we have our guest here. Mr. Uche, I would really appreciate it if you can put on your video, sir. Hello? Mr. Uche? Sorry, can everyone hear me? I want to be sure everyone can hear me.
Well, I can hear.
Okay.
I cannot.
Mr. Uche?
And audio is not connected. So that's why it's not speaking.
Oh, okay. His audio is not connecting. Sorry, I didn't hear that clearly.
Oh, it's not connected. It's not connecting with audio. So that's why it's unable to speak. At least from what I can see.
Okay. Probably when he rejoins. So I don't know what's happening. Okay, maybe when he rejoins. Okay, so before he joins us back, I would just like to read out some facts that I have here about health insurance. So when our guest joins, then we'll start with the question and answer session. Okay, so I'd just like to quickly mention some 5 reasons why health insurance is needed in Nigeria. As Nigerians, health insurance is not really a topic that people really discuss. Everybody just thinks that, when you're sick, just go to the hospital, you pay out of pocket. I think out of pocket payments is like the most common form by which people access healthcare in Nigeria. But there are actually reasons why you should get an health insurance, even as a Nigerian, even though it's not something that people, like the majority of people, do. Number 1 is to combat lifestyle illnesses. Lifestyle illnesses are, welcome, Deborah. Deborah is going to be my co-host today. So please just quickly introduce yourself. I was just trying to talk about some things. Your mic is muted. Please unmute your mic.
Hello everyone, good evening. My name is Deborah and I'll be hosting with Damilola today. Thank you.
Okay. Yeah, thank you, Deborah. Okay, I really don't know. I don't know what's happening. Our guest is supposed to have joined us by now. Sorry, everyone, about that. I'm just. Okay, so, okay, I think our guest has rejoined us. Mr. Uche, please, can you hear me now? Hello? Okay, so I think he's still having some difficulty with the audio. I really don't know. Okay, okay. Hi, Mr. Uche, please unmute your mic. Sorry about the difficulty.
All right. Yeah,
Yeah.
good.
Yeah, good evening. We are really happy to have you here. Thank you so much for joining us. Okay.
Thank you for
Yeah. Yes, okay. So I said I've already spoken to us about like what we want to discuss here today, which is health insurance, majorly for the Nigerian audience, which is not something that is really usually discussed a lot in Nigeria. You see, most people rely on like out of pocket payment for hospital bills. So I quickly wanted to state 5 reasons why Nigerians should actually get health insurance, and I have them written down here. Number one is to combat lifestyle illnesses, which is what I think is things like hypertension, diabetes, and everything, which are like over a long period of time, people keep like treating them, like you keep buying drugs and all of that, and health insurance to cover that. Number two is to compensate for insufficient insurance plans, and that might look like, an irony or something, but most people in their workplaces, they have like health insurance, like NHIS, that just covers for like basic things. But getting health insurance outside of that, like is using HMOs and all other things like that to cover for other illnesses that are not covered under the ones you get from work. And then number three is to combat medical inflation. That is, if you are getting an health insurance now, like over some period of time, you expect that those drugs will actually get more expensive, but you're already buying like an health insurance plan now. And then through that, even though there's inflation in terms of like doctors' charges or prices of drugs, you still know that you are able to get treated at that particular period of time. Then for the feeling of safety, and finally to safeguard your savings. So those are just some 5 points that I noted down for why you actually need to get health insurance as a Nigerian. But I'm not going to do most of the talking. We have our guest here, Dr. Chukwuemeka Uche. He works at OMH, that's Oyo Mesi Group of Hospitals, Oyo State, and is an health insurance manager. And he has all of this bulk of knowledge to dispense to us today about health insurance in Nigeria. So please feel free to ask your questions. You can type them here on Zoom. If you are joining us on our website, you are free to just type your questions there and we'll ask him. But before we go into the question and answer, I would just like you, sir, to talk to us generally about health insurance in Nigeria. I know even for me, I find it difficult sometimes to, separate what is NHIS, what are HMOs, how do I get health insurance and all of that. So please, sir, if you can just give us like a basic summary of this, health insurance in Nigeria. Thank you, sir.
Good evening. Thank you for hosting me. So let's understand the concepts of the health insurance. Federal government actually said that everybody should fall under a health insurance scheme. And so in so doing, they provided a national health insurance scheme. The national health insurance scheme is the body governing all health insurance, be it the private HMOs and the NHIS itself. Now, what happens is this: those who work in the private parastatals and those who work in the federal parastatals all have one HMO or the other that they link and attach them to. Now, for those who work in the federal parastatal, they attach them directly under the National Health Insurance Scheme. Now, the National Health Insurance Scheme is affordable health care to individuals, knowing fully well that yes, as time goes by, healthcare, the cost of healthcare has been on the rise. So they actually want every individual to be able to access healthcare at a very minimal price and with no cost at all. So they provided this scheme so that everybody can benefit from it. Now, there is a huge difference between the national health insurance scheme and the private, we call them the managed healthcare, the private HMOs themselves. In the sense that there are some treatments that the National Health Insurance Scheme, you understand, will allow enrollees to go through that those in the private scheme, you understand, would also want would want the enrollee themselves to have a part payment with it. Now it all starts like this. An individual wants to enroll for a health scheme would have to contact the HMO and then have this agreement with them on the kind of health care service they would like HMO to render to them. Now, there are different aspects in which this or different categories in which health service fall into. But when you have to enroll for a package under the healthcare service, you see a list of services that these HMOs provide for you. Now, if you are the person that doesn't really fall sick but just wants to have an insurance scheme, because normally what an insurance scheme is all about is to protect you against any unforeseen circumstance when it comes to health emergencies. So you actually are prepared for it so that this insurance company can protect you at that particular time when it comes to the cost of this health services. Because we never can tell in a situation whereby there is an emergency, for instance, an accident, maybe a situation whereby a major diagnosis has been uncovered for a patient, and the procedure for all this would require a lot of money. If it's someone who has actually been under a health insurance scheme, all those who are okay, let's assume he has actually benefited, say he has benefited anything tangible from it at that time, yes, his health insurance his HMO will come out for him and pay the cost of his services at that particular time. So as he is covered or she is covered or the individual is covered for that particular service. Now, what are the benefits for health insurance for us registering a health insurance or for us being involved in a health insurance or for us having to register for a HMO? We have a lot of benefits for this, and this actually includes us being having to get ourselves involved in direct payment with the medical cost. This comes in the sense that, yes, like I just explained, you've actually been paying for health insurance all this while. Now you have a situation whereby you have to pay for services for an emergency. You actually want to step in for you. Can you hear please?
Yes, I can hear you, but sorry, I'm struggling to hear you. It's not really audible, and I think the earpiece is shaking a little bit. So it's
Okay.
yeah.
Hold on, please. What about now, please? Can you hear me?
Yes, I think it's a little better. But if you can just
Is
make
this
it louder,
better?
please. Yes. Yes.
Is it better?
Yes, I think it's okay.
Yes, thank you.
All right then. All right then. So I was talking about the benefits for health insurance. What benefits for health insurance? First of all, health is becoming very expensive, and we all know that, yes, from time to time, health costs a lot, especially when you have to be admitted in the hospital. Then you know that, man, health is actually something you shouldn't joke with and all, because at the end of the day, once your medical bill comes out, you know that it's quite expensive, And this is where health insurance tries their best to protect us from these expenses by coming in and having them pay for us in these services because we've already registered with them in one way or the other. Now, it's always difficult for a family to gather up money to get in terms of emergency to help, pay for the cost of services that hospital will require them to pay for. Health insurance have them covered in situations like that because along the line, they expect that the health insurance will come and stage in for them. Understand? So that's one of the benefits that they get registering themselves under health insurance. And secondly, you don't actually have to go around all the time to the hospital having cash with you and all that. Since you registered for health insurance already, you understand, all you need to do is to go to the hospital, present your policy number, understand. If the hospital is actually registered under the so-called HMO, all they need to do is to get in your details and dispense whatever it is you need to be given as long as you've seen the doctor and the doctor has diagnosed for you. So those are one of the benefits you get registering under one of the HMOs. Now, what or how do you go about registering HMOs? Yes, there are a lot of HMOs in Nigeria, including the National Health Insurance Scheme. There are a lot of HMOs in Nigeria, but there should be an understanding that the National Health Insurance Scheme is quite different from the services the National Health Insurance Scheme renders is quite different from the one the private HMO will render to also, the cost of the National Health Insurance is very different from that private one. Now let me talk about
sorry, sir, it's getting more difficult to hear you again. I don't know if it's a problem with the episode now.
You can't still hear me now. Can you?
Yes, I can hear you now. Please go on.
Are you sure it's
I don't know. Deborah, can you hear clearly? I don't know if it's from my end. I'm having difficulty hearing.
My battery.
Not from your end alone. I also have
No, not to church meeting, like medical meeting.
Can you hear me? Hello, can you hear me?
Yes, I can hear now. I can hear now.
All right, hold on. Let me just set my so you can clearly now.
I think we're struggling. I think the earpiece, because I can hear the sound of the earpiece, like where it's connected to your device. So it's probably that, because over time the sounds just keep like wavering. I don't know if that's the problem.
Even now, can you still hear the sound now?
Yeah, no, I can hear you clearly now. Please go ahead. Sorry about it.
You can hear me. Are you very sure? Let's confirm that. Can you hear me clearly?
Deborah, can you hear him clearly?
For now, I can hear you, but sometimes when you are into your conversation, I can no longer hear you. So maybe you can.
Okay. I'll try. It's audible. So I was saying earlier about the differences between the National Health Insurance Scheme, its packages, and the HMO's package. Now, what happens is this: when you register for a private HMO, you are mostly covered for a lot of services that the hospital will render to you, depending on the kind of plan you registered for. So, hello, can you hear me?
Yes, I can hear you. I can hear you. Please go on.
All right, good. All right. So once you click on these HMOs and register under them, you are allowed to, based on the services you covered for, you are allowed to see the doctor on those services. And if you are to undergo any procedure, you understand, the HMO will cover for it. Now, there are situations whereby you have limits to the number of services you can use under the HMO. Now, when you get to that point, you would actually be told to pay part of what it is that the hospital demands from you. You understand? It comes in a situation whereby you have a surgery and the surgery costs, let's assume 400 naira, you understand? But your HMO limits you to 250 naira worth of surgery according to the plan you registered with them. Do you understand? So the HMO will expect you to balance up the remaining cost of the surgery. That is how it works under there. But for every other thing that has to do with prime care, you are all covered for it. So if you have yourself registered for insurance, you should be rest assured that at any given time, once you get to the hospital will attend to you properly without you having to pay any money at all. Why? Because you have already paid upfront your HMO for them to be able to cover any services relating to your health issues. So that is actually one thing that makes the HMO or the insurance aspect good, because you don't actually have to be going to the hospital every time thinking of how much you spend in the hospital. Because yes, you might decide that you go to the hospital today all because of headache, you understand? And when you get there, you discover that it's another thing entirely, so many tests, and you feel you don't have that. Well, you have an insurance, and also you don't actually need to fall sick before you go and see the doctor. You will always go for a checkup, check what's wrong with you, and if you're fit, you understand. So you having a health insurance is actually one of the appropriate thing an individual should do, and actually get to the point you get or it becomes very ill, understand, and which is not diagnosed with a serious illness. For instance, now HMOs have this agreement that once if you are to register, there is always a waiting period. Now, for those who don't have chronic illness, understand, for those who have chronic illness, there is always a waiting period of, I think, a minimum of 7 days before you can get activated in the plan. Now, for those who for those who don't have chronic illness yet, there's always a waiting period of 7 days which can get activated in the plan. Now, for those who have chronic illness, you have a waiting period of at least 1 year. Sometimes it can be more than that, at least 1 year. So imagine you going to this insurance or because you have an ailment. You should know that you won't actually get the services you think you wanted to, or the reason why you started insurance for. You won't actually get at that particular time. It's always better to register insurance early so that at any given time when it's requested for you to see the doctor, you can always go and see the doctor, and you rest assured that you're covered for it. Let's talk about okay, one of the issues enrollees always face during registration of HMOs. Now, another issue people always have is this: they always want they always want uh, they always want their they always want the place where they always want the place where they can access one of the now when you talk like this, I have a lot of enrollees who come and ask me, okay, I want to use this hospital. And so how can I go about using my HMO in this hospital? Now you should understand that HMOs have partnership hospitals. They have partnership with hospitals. And if you're actually registering a HMO because of a particular hospital, I advise you to actually go to the hospital and ask which HMOs do you actually use and which one are the best ones that can cover the kind of service I want the HMO to run. So the personnel in charge of insurance in that hospital should be able to give you a breakdown and the full details of the kind of HMO they use in the hospital, so that you will be able to select. selecting HMOs is not all about, saying this particular HMO, you pick it, then you want to now go to any hospital. No, it doesn't work that way. And another thing is trying to select a HMO that has its service in the hospital where you live. It's not always for you to pick a HMO, and at the end of the day, you have to go miles before you can access care. Because in terms of amenities, you always be able to have your facility very close by. So those are one of the things you should look out while registering for HMO. And another thing is, one of the issues patients always have, when we always have, is when it comes to the time of payment. You see them asking us, okay, why is it that this particular service is not covered, and they are asked to probably pay for it because they're not covered? Yes, when you are registering for a HMO, you can ask for the kind of plans you get that the HMO have and the benefit or the things that it covers, because they have a lot of benefit. So you should always go through the list of benefits that this HMO is offering, and different parts of the services. Services that covers major surgery, and the services that cover minor surgery, and the services that there are services that you pay for that doesn't even cover antenatal itself. So you should always be aware. There are people, there are HMO that if you register on an individual package, you won't be covered for some things. But if you register through the corporate package, you'll be open to it. So you actually need to go and do your research and understand all this stuff, especially once you select the particular HMO that you want to use. Go to for the HMO and understand what the HMO is ready to offer, and if it meets with what your medical condition or the reason why you want to actually register yourself on the health insurance scheme.
Okay, thank you so much, sir. Actually, I was going to, point out some things and ask some questions that I know some people will also be wondering about the answers, and I think you've already covered some of it. But I'll still just like clarity on some things, like for these HMOs now, what are like examples of some particular illnesses that they wouldn't just cover for you? Like, is there any illness, let's say a particular type of surgery or something
now, this is the concept. In Shikim, they're also running a business, and they actually want to put in people, a lot of healthy people, to register. Why? Because we know that you won't always go and.
Sorry, I can't hear you clearly. I don't know if it's just me, but I'm having difficulty.
Can you hear me? Can you hear me now?
Yes, I think I can hear you now.
It's better now.
Okay.
It's better now.
So, so what I'm saying is this. Yes, there are services, you understand, that HMOs will want to pay for and do want to pay for. Now, the thing is, HMO always prefer healthy people to register insurance scheme, because they know that definitely this set of people won't always come, you understand, to acquire cost. But for those that have chronic conditions, now the services now limited to specific people. For those that have chronic conditions, you have to go and register for a higher package. There are services such as let's go with hypertension. Hypertension, diabetes, you understand? Those are chronic conditions, heart disease, chronic conditions, you understand? That the HMO that you will definitely come every month to the doctor. And there are times when, the patient might fall into some kind of shock, understand? It will require you to see a consultant, understand? Those are costs inside of HMO. So then, those services will require extra package under the HMO, or the patient, each time they come, they will requested the authorization will come from HMO for the attended to. Now, apart from that, surgeries, in particular, you understand, these are all the things that the HMO might not do, because the HMO might not cover the enrollee for.
No, sorry, I can't hear you. Please, can you try to remove the earpiece at first? Let's just see if that is the challenge. Is it possible for you to remove the earpiece? Because
Okay,
there's just this interference here.
All right, I have. Can you hear me? I've moved it. Can you
Yes,
hear me?
it's a lot better now, like way better now.
All right then. So I was talking about surgeries. Surgeries basically always need authorized from HMO. And trust me, it's not all the plans under the HMO that cover for surgery. So if an individual does a plan that doesn't cover surgery, he should rest assured that he won't get that back if you have to pay for it. Because at the end of the day, once the hospital requests that from the HMO will give the hospital feedback that he or she is income for it, and that will expect the person, they will expect the person. Let us have it now that mostly surgeries, because at the end of the day, you see they have different sections. They have sections where procedures are falling under. They have procedures. They have the medicines, the drugs. They have the laboratory, and they are also laboratory tests to investigations that can cover too for some enrollees, yes, and depending on kind of package. So it all falls on the package and okay, now this is the thing. As an individual, me and you get right now a HMO, you understand? We can actually go online based on how it's easy now for everybody to access care. You understand? You can actually go online now, pick one of the best HMOs or the ones you feel is okay, you understand, and register and develop. But you should understand that for an individual plan, they have different sections. So you need to go through the section that fits you, understand, and check what you have. It's not just every section you go into and just subscribe for. So once you've done that as an individual, you start, okay, then let me check all the individual, you understand, doesn't cover antenatal. Understand? If you start as an individual, you understand, you are not covered for antenatal, and you have to go through a complete plan. That is just registered under a organization, that actually uses the HMO. Then you will be open to all the services that the HMO has. I now understand the concept of it, that the HMO is going through using quantity now to secure the cost. So in sense that they're pulling this particular into a company, you understand, and so that it is a whole lot of them. Yes, quite all right. We can open the services there because yes, they've actually gotten, you understand, what they want to get, you understand, and they can use that to secure anything at any particular time once there is an emergency for an individual. So those are kind of things other services that are not covered.
Okay, sorry, because I would like to just be chipping in some questions. You know, we have several questions on the website, and also we have some things that we also want to clarify. Okay, so you mentioned that surgeries particularly are the ones that are not usually covered. But what about things that are generally expensive, like let's say dialysis? And can something like that be covered by?
Now, we categorize things like that under procedures. Even delivery is under procedure, you understand? The antenatal care, say, okay, let me emphasize how services are under the aspect for drugs. Okay, we have aspect for consultation. Okay? Now we have the aspect for investigations, be it radiology, be it the lab test, it falls under investigation, and we have the procedures itself. Do you get me? So when it comes to consultation, basically almost everybody's covered for consultation. Do you understand? For drugs, everybody's covered for drugs. And for investigation, everybody's covered for investigation. But you see, for procedures now, procedures are most of the time they're expensive. Now, procedures fall under the surgery, the dialysis, like you just said, you understand, the delivery itself, anything that has to do with maybe a constant being on.
Sorry, it's getting difficult to hear you again, please. Can you make?
Yes, can you hear me?
Yes, I can hear you now.
Okay. I was saying anything that has to do with basically, the patient going through the theater per se, you understand, falls under, and those things you can't just access them like that because they are quite expensive. So there's a limit to the kind of for just anybody. So we have different packages and different plans. Yeah, those are more expensive than the others. That if you're expensive one, yes, you are to cover services that won't be to access. So those services now will open up to go for higher packages under the HMO. So that is how it's like that.
Okay, all right. Thank you very much for the answers. I'll just hand over to Deborah now. Deborah, please, do you have anything to share with us or some questions to also ask?
Yes, thank you very much, sir. Although I could barely make out some of the things you said, but I noted some of the things and I'd like to give you a recap before I ask the question or I ask the question. So some of the things Pastor said is that having a health insurance is just like paying ahead for your medical, so you don't have to do it on the market. You can more like pay on installment. And then
I'm struggling to hear you. I can't hear you. I'm struggling to hear you, please.
Oh, all right. Jamila, can you hear me?
Yes, I can hear you, but I was also struggling to hear you.
Oh, okay. So I was trying to do the recap of what people have said, that investment, health insurance is just like paying upfront for your medical expenses, so you don't have to pay immediately. But one thing I noticed is that I want to ask, is there any difference? Because we've talked about the HMO, and I assume that the HMO are like specifically the private registered private organizations that deal with health insurance. You didn't, or maybe I didn't hear, maybe the network. I don't know if you talked about, is there a government provision for health insurance? And if there are, then what can we do about, like, is there a way to access that?
Yes, we have government provision for health insurance, and that is the National Health Insurance Scheme. You understand? Now we have the federal government, also the state government. You understand? So, for instance, here in Badon, we have the Oyo State Health Insurance Scheme. You understand? So if you actually want to list for the federal health insurance, which is the National Health Insurance Scheme, we have centers where they are located. Basically, or mostly, have them around local government area, the LGA area of the state. You understand? You can find them in those places, and you can actually walk up to them and tell them that you actually register for the National Health Insurance Scheme. I want to tell them that they get your details, you fill the form, you submit to them, they give you the amount that you're going to pay annually, because payment for health insurance scheme is actually a year thing. So you pay annually for that. So once you pay for that, give you a which your ID or the policy number will come out. And once they've generated that, you will now be placed under a hospital. So you allocate to the hospital. And that's just that hospital alone that you will be able to ask care under the National Health Insurance Scheme. So if that hospital alone you will be able to access care. Another thing is, although yes, for the National Health Insurance Scheme, you can actually access care only on emergency basis. Understand? Only on emergency basis. You can only access care in another hospital only on emergency basis. So if you find yourself in a hospital, can you hear me? Are you struggling to hear me?
Yes, I am struggling.
Yes, it's a bit difficult, sorry, to hear you.
Okay. I really don't know what's happening to the audio this time around, but let me continue. Let me see if you can actually hear me better. So can you hear me now?
Yes,
Yes.
I can.
Okay, I was talking about the National Health Insurance Scheme. Okay, you can register as a specific center where they are located, and mostly you find them around local government areas.
Sorry, maybe you should try turning off the video. Maybe it's the network. Let's just try that too, so we don't miss out on what you're saying.
Okay, can you hear me now?
Yes.
I can.
Is it clear enough?
Yes, it is.
Okay, so I was talking about the National Health Insurance Scheme and how to register about the National Health Insurance Scheme. So yes, if you want to register the National Health Insurance Scheme, you have to go to their centers, and their centers are located mostly in the local government area, wherever you find yourself. You'll be able to see National Health Insurance Scheme center there, and once you get there, you will just ask them about the procedure or the process for registering. Normally, what they will request from you is your details, your full details. They'll give you a form. You fill that. Once you fill that, you'll be requested to make payment. Now, this payment covers for a year. Once you've made that payment, you will actually be given a time for them to process your details. And once they process it, you'll be given an ID number. Now, that ID number is called an enrollee number. Once you're given that ID number, you'll also be given a hospital or be allocated to a hospital where you'll be accessing care for the period of, or for the time being, or for when your insurance ID lasts. You'll be accessing care in that hospital until your plan expires and until, okay, the thing is this, you are actually able to access care for 3 months in that hospital, after which you can choose to switch to another hospital. But the main thing is that once they allocate you to that hospital, you cannot use any other hospital apart from that hospital. So that is how the National Health Insurance Scheme works, and also the state government health insurance too works in similar manner. But for the private, you can actually access care in any place as long as you have your ID number and the hospital makes use of that private HMO.
Okay.
Oh, okay.
Okay.
So, okay, thank you very much, sir, for the response. So that means, okay, National Health Insurance Scheme exists for better advantage. It's easier, or it's better to go for private health insurance scheme. Okay, then another question I want to ask, I'm going to ask the question before I move to the questions we have on our website from my personal experience. I was on National Health Insurance Scheme for a couple of years. I was depending on my dad, so until I clocked 18, that was when I stopped, because I mean I could not continue with that. But I can remember vividly twice on 3 occasions that we were given drugs that are not good enough, because personally now I think I had a condition then, and then the drugs I was given were not so good, and that I guess that was because I was under NHIS. Number one, if this happens to a person, the first question I want to ask is, how can the person come back? How can the person fight this? Then the second thing is, does this also occur with private insurance? the private companies, private HMOs now.
Okay, if I got you clearly, you said you are given a drug that wasn't good enough.
No, the quality of the drug is not as good as what I expected. Like for I think if I want a particular drug, it took a long time before maybe we even have to buy another drug. I have to go to the pharmacy to buy
Okay.
malaria drug for instance.
Yes,
Yeah.
I understand what you're saying now. Okay, yes, the thing is this: the National Health Insurance Scheme have a list of drugs that are covered and the brands. Now, the reason why they didn't dispense a certain kind of drug to you at that particular time is because that particular brand, you understand, is not covered under the National Health Insurance Scheme. They only go with what the National Health Insurance Scheme has given to them to follow. They cannot go outside that. Do you understand? So what the hospital did was actually to give you the drugs that were listed under the National Health Insurance Scheme, the drug list, for them to be able to dispense to their patients. And they gave you those drugs. Now it's left for you to ask, okay, this drug is not working well. Which other drugs can I get? Do you understand? And probably the doctor will suggest another drug for you to get. But as for the National Health Insurance Scheme, the hospitals are not allowed to go outside the drugs or the services that has been listed on the scheme. So
Okay.
probably that's
All
what
right.
at that particular time.
Most likely. All right. Thank you very much for the address for the correct response. Some of the questions we have from on the website, I'll read some of them out there. Once the first question there is there an existing insurance coverage for mental disorders? Like a mental coverage solely for mental disorders?
Yeah, that's psychiatric, right? Yes, of course, of course. Yes, of course. Yes, of course, they have. And it all falls under, the kind of plan you have registered for the insurance. Do you understand? Because it's not all the plans that cover for psychiatric care. So you need to know the kind of plan you can actually work with. You can actually get psychiatric consultations from basically most of the plans, you understand? But when it comes to psychiatric care now and the kind of drugs that will be given out, you understand? It varies from the plans. So that is how it is. But yes, all HMOs are expected to cover most services under medicine.
Okay. All right. Oh, thank you, Deborah. Please, I would just like to quickly point out to everyone that if you have a question, please just type it here on Zoom. If you are here with us on Zoom, please feel free to type your question here. We really appreciate it. We have our host here, is an health insurance manager for Oyomesi Group of Hospitals in Oyo State. And any question you have about health insurance, let's say you want to get an health insurance plan, either for private or for NHIS, please just feel free to ask your question. You can ask for directions right here on Zoom or even on our website, and we'll definitely answer any of your questions. So please go ahead, Deborah. Thank you.
Thank you very much for that. Another question we have on the website is someone is asking if there is a health insurance plan for the elderly. If yes, how can they go about it?
Okay, you mean plans for the elderly, right?
For older people, yes.
I don't think I've heard of such plans yet. I don't think I've heard of such plans yet, but I know when it comes to the treatment for elderly people, you understand, like regular treatment, yes, depending on the kind of diagnosis the doctors have given out, HMOs will cover for that. But once it comes to the care, probably something like elderly homes and stuff like that. Now, I don't think the HMO covers such services where you register for an insurance just to place another person in a home. I don't think so.
Oh, all right. Okay. I believe the person that had that would have gotten the information. Someone dropped a question in the Zoom in the chat now before I continue with the other questions. So the person is asking, that you mentioned something about you mentioned something about there being no coverage for antenatal care. Please, can you tell us more about that?
Yes. What I was trying to say is this: you have to actually be careful of the kind of plan you register for, because there are plans that don't cover antenatal care. So in registering for health insurance, you need to go through the list of services or the benefits that the insurance, the HMO, has listed under that particular plan you're trying to register for. Because, for instance, now the example I gave is that there is a particular HMO that if you are registering for an individual plan, that is, you're on your own, you just want to register this service under them, they would not open up the antenatal plan for you. Only if you are actually working with a company and you go through the company plan, that is when the services will be open to you. So you need to know the individual plan alone under a particular HMO doesn't actually open for antenatal service. But trust me, there are other HMOs that their individual plan opens someone up for antenatal service that I know of too. You understand? So it all varies. But the key point is that you need to check the list of benefits that the insurance plan is giving for that particular plan you want to register for before you go ahead and purchase it. So you will not waste that particular money.
Okay, thank you, sir. So, okay, I think we have another question here. Okay, Deborah, please, you can go ahead.
All right, we have a question on the chat. Someone is asking, good evening, sir. Thanks for the enlightenment. I work in the hospital and I see the stress people on insurance go through before sorting out their job and other payments. I understand that there are lots of processes to follow, but do you have any advice one can follow to have a faster and easier ride when in the hospital? Did you get the question, sir?
Yes, I got the question. I got the question, Mr. Paul. I would suggest the hospital works on their customer care service. It has nothing to do with the HMO. It's all about the customer care service. If you are delaying your patient, then the customer care service of where you're working is faulty in a way. You understand? You should not delay, and everybody, be it the HMO, be it those that are not HMO, are entitled to have access to quick healthcare service. And it all boils down to the kind of customer service that the hospital is giving out. So if a particular patient is saying he gets quick service in this hospital compared to this hospital, it is not about the HMO. Most hospitals use HMO, you understand? It's not about the customer care service. I think they should work on the customer care service of that hospital.
Okay, thank you, sir. Please let me just quickly ask my own question, Deborah, please, before you continue. So I know you mentioned in the beginning, sir, that drugs are usually covered, but procedures might not necessarily be covered. But then what if someone has something like cancer, and you know how expensive anti-cancer medications are, or let's even say the anti-cancer medication has to be imported into the country and is not currently available? What happens in that kind of instance? Can that still be covered if you have an anti-cancer medication, let's say like docetaxel or something that is like 60-something thousand naira or 100 and something thousand naira? Can that be covered? And then if it has to be imported into the country also, like there are some drugs that anti-cancer medications that are not currently registered in Nigeria, what happens in that instance? Does the HMO step in that case, or they just ignore that kind of condition?
No, the HMO will not ignore the condition. The HMO wants to take care of the individual. You understand? And it's because of the individual registered for the insurance, so that the insurance company can actually take care of him or her. You understand? So now, for those who are having cancer and all that, who wants to go for chemotherapy or the rest, you understand, having drugs that are imported and all that, yes, of course, it all boils down to the plan that the patient paid for.
Okay, so does that mean
something
that,
like that?
what I'm trying to ask is, okay, so I didn't know you were still, please go ahead.
Okay, yes, a patient that have issues like that definitely will pay for a higher plan under the HMO, and it covers him for every other thing.
no matter what. Yes, of course, several times we have patients who have gone through chemo cancer treatment under HMO, and the HMO covered for them and they didn't pay one bit. Yes, of course. So the insurance company also covers for ailments like that. When I say not covered for, it comes down to the plan the enrollee pays for. So the enrollee either have to upgrade the plan, you understand, or in a situation whereby the HMO covers for that plan, but the amount is not up to what hospital is doing. So the HMO will tell the patient that, okay, this is the amount we are covered for under this plan. Maybe you use your money, or you will use your money to balance the remaining. That is how it goes.
Okay. So my question now is, if let's say you have like a treatment that is like 1 million naira or something, what is the minimum amount that you must have paid into that plan before you can withdraw? I mean, we can get treatment of that amount. I don't know if you understand what I'm trying to say. That is there a baseline payment you must have done into your health insurance plan before you can get treatment of like very high amounts, or
Yes, of
is it
course.
later
And,
on?
of course, and that's where it boils down to what they call the waiting period. So you must have subscribed to them for a period of 1 year for them to now be able to activate or open you to all these other services. So, but normally, once you register with them, you're open to primary care, to come into the hospital and receive normal treatment, primary care treatment. You understand? Also be admitted based on normal primary care diagnosis and all. But once it comes to serious ailments, chronic conditions, it's that particular period now that you have to wait for. So once you waited for that period, then you can now probably always mostly a duration of 1 year. Once you waited for 1 year, then the HMO opens you to all the other services, the procedures that are expensive. So you can now continue with chronic ailments under that service that you subscribed for.
All right. Thank you so much, sir. Please continue, Deborah. I see we already have some comments and questions in the chat.
All right. Thank you for your responses so far, sir. So we have 3 questions, three additional questions. So thank you for your feedback. Someone is asking, you mentioned earlier that NHIS does not cover for emergency care. Is that the same case for private HMOs? Thank you. Should I go back?
Okay. Yeah, that is yes. No, you didn't get me right. I was explaining, probably that was when the audio was given issue. I was trying to explain that NHIS patients, whenever they are registering, there is they are assigned to a particular hospital, and they cannot have treatment outside that hospital. Only on emergency cases, a situation whereby if you're outside the state where you registered, you understand, and you have an accident and you are rushed into a hospital that makes use of NHIS, you can tell them that you are registered under the NHIS. You understand? On emergency base, the hospital will treat you with the NHIS policy plan. You understand? So that question, you probably didn't get me right. You can be treated on emergency with NHIS.
Okay.
All right. Thank you for the clarification, sir. Thank you for that. Okay, we have a follow-up question to the earlier question we had on the stress people go through, on people that are on health insurance go through when they go to the hospital. So the question is that the person is asking that there's also the problem of patients not getting some particular brand of drugs or a particular quantity because they are on insurance. And these are people on the biggest package the insurance is offering. So the person is now that another question, do you know any insurance package or company without such restrictions? I can personally attest to this that I think beyond customer care, people go through series of issues. They might go through, it might be a little harder for them compared to a person who is coming to pay out of pocket. So we have a question asking if there are any insurance companies without such restrictions.
The thing is this. The thing is this. When it comes to drugs not given, especially for a particular brand, that mostly happens with the National Health Insurance Scheme, and that's because the National Health Insurance Scheme has already created a list of drugs that should be given out for their patients. So, in a situation whereby a patient desperately needs a brand, you understand, but because he or she is on the NHIS, we have no choice than to give out the drugs that the NHIS have, listed. But we can suggest the patient to get the drug that suits the condition. But then, concerning, I want to pay attention to Paul's question. He said, "Thanks for the clarification on the first question." Okay, Mr.
Just
Paul.
like him.
Mr. Paul, if you've seen it everywhere, then I guess the hospital needs to work. The hospital itself needs to work on the customer care, because all this have a stated agreement. You understand? You are not allowed to delay any patient in any way, except they are not communicating the right message to the patient. For instance, now, giving the patient the drug, okay, for the unbranded drugs aspect, you understand, not explaining well to the patient that this drug is not covered under the scheme, and having the patient, just live like that, feeling bad, the hospital isn't giving them the best, not knowing that that is the agreement that was made under the NHIS. So I think communication to the patient, let the patient understand what is going on. The hospital should not hide anything from the patient at all. So it all boils down to still customer service. And although yes, there are some large hospitals, federal hospitals that doesn't even have time for stuff like that. So the patient should actually, pick a better hospital. Or you can always, if it's under the NHIS, you can always select the hospital that you want. You understand? Even the private HMOs too. But you hardly see things like that under the private HMOs. You understand? You hardly see things like that under the private HMOs. The private HMOs always cover a lot of drugs. Why? In the sense that when you're onboarding a private HMO, the hospital too drops out the list of the drugs they dispense. The hospital gives out the list of drugs they dispense. So the HMO is aware of the list of drugs that they dispense, and they agree to that. But the NHIS, you're not negotiating with them. They already have their list of drugs, and you have to abide by that. So that is why it's that way. But for the private HMO, it's different. There is always a communication, a negotiation before the onboarding. So they know the kind of drugs you have. They also let you know the kind of services they render, and there is an agreement on that. That is why the private is always different from the National Health Insurance Scheme.
Okay. Thank you so much, sir. Yes, thank you. Thank you. I just wanted Mr. Uche to give us like a broad overview. Let's say I'm just very fresh. I want to come to get like an health insurance, like plan to use either private. Okay, let's say private, because I know NHIS is usually a little bit more different. So let's say for myself now, I want to get an health insurance. How can I go about it? How much should I hold? I want to have a very good package that, even later on in life can cover for many things in case of chronic illnesses or anything. How much should I come with? Where can I go to? How can I go about it? So please just give us a breakdown of that. People that don't know.
Okay, let's start with the private HMOs. Okay, first of all you need to do is to go on Google, search for private HMOs in Nigeria. Now, it will bring the drop down of all the HMOs, you understand? Go through them one by one. Check for the one that fits what you want, you understand? Go through the services they render, you understand? And see the prices they are offering for their package. So for the private HMO, you can always register. Majority of them, you can register online. But some you have to go to their office, you understand, to indicate that you want to register. So it's all about, and some you always most of them you always see their customer care service number on their website, you call them and ask for how you can go about it. While others, they'll just direct you to their registration portal online. You fill in your details, you understand? Select the plan you want to select, you understand? Fill some other basic information they request from you, then make your payment online. And from there, they will give you your ID number, policy number, and the rest. Select a hospital. Selecting hospital will actually be part of what you're filling in the form. Then once you've done that, you wait for some period and they'll give you an email and SMS that you have been activated. Then you take your ID number to the hospital that you know that make use of that HMO, then present the ID number to them. They'll check you in and see if you're active. Once you're active, you can receive care at any time. Then for the NHIS, I explained the other time, you will have to actually go to the local government area where a National Health Insurance Scheme is located. Tell them you want to register for the National Health Insurance Scheme policy. Then they will tell you on how to go about it, give you a form to fill, almost the same process, your ID card, your picture, and all that, you understand? Then they'll give you your ID number once you're registered. They'll tell you to come back for it. There's always a period you wait before you get your ID number. So that's how it's done.
Okay, so just to clarify, is it just rich people that can get access to something like this? That's why I'm asking for a price range. Is this something that a trader, just someone that is earning very little, can
Yes,
also have access to?
for the National Health Insurance Scheme, it's actually made to be easy for everybody. So it's actually affordable. Anybody can go. It is for everybody. The NHS is for everybody. It doesn't limit you to you working in a company or not. An individual can go in and register. It's affordable. They will give you the price. Me personally, I don't know the current price, but I think it was 9,000 naira at a particular time per month. I think. I'm not sure. I can't remember if it's that. But I think the last one I was informed about, someone told me they paid 50,000 naira for a year. So it all depends. You need to go and confirm. I can't really pick the price. While private HMOs, I think the least I've seen is 45,000 naira for a year. The least I've seen 45,000 naira for a year. You can actually break it down to monthly and know what the cost is. So that is how it is.
Okay, so sorry, my final question. What then happens if I don't ever fall sick? I don't ever make use of this, yet I've been giving you 45,000 naira per year or 50,000 naira per year. Can I recoup my money? Can I take back my money like after I've noticed that I don't think anything is wrong with me?
No, you can't. That's why it's called insurance. Why? Because they can never tell when an individual will fall very sick, and cop a lot of money from them. That is why they are always looking for a lot of people to register under the scheme, knowing fully well that it is not everybody that would, see the doctor at that particular time. So that is also their insurance too. That is also, what they are using to, secure themselves concerning things like that. So no, you cannot collect your money back. You cannot collect your money back. It's an agreement. An agreement.
All right. Thank you so much.
I know of someone who paid 45,000 naira, something like that, and received a surgery of 600,000 naira. So you never can tell. So it's all insurance, and that's what it is.
Okay. Thank you so much, sir. Thank you. Over to you, Deborah, please. Go ahead.
Oh yeah. Okay. I mean, I was going to ask the question you asked. I really wanted to ask what would happen, but now that you have clarified it, but just as a follow-up to what Daniela just asked now, if I were to be a parent and then I have a health insurance with a private company and I did not register my child, but say my child has an issue, and then I want to cover the child under my health insurance. Peradventure, I've never used the health insurance. Is that possible? Is it possible without registering the child? Maybe just like use mine for. I don't know if you get my question. Is that possible?
I get your question. No, it is not possible. You need to register your child because it's just like normally when you get to the hospital, you cannot use your card for your child. You need to register your child's card too. You need to open a card for your child. So those details you've registered, understand, with the HMO, with the insurance company, they already have those details. and they follow up on, even if it's just malaria treatment they received for a day, you understand? They follow it up on their own side, also having a case note of all the treatment you've been receiving, because the hospital always send that to them. So you cannot now bring in a condition of a 3-year-old into a card of an adult. You get, it's not possible. So the same thing applies. You have to register your child too on the scheme. Any other person that wants to register must register too on the scheme.
All right, sir. Thank you very much, sir. So on an average, maybe you've mentioned this, maybe it could be that the network was disrupting. How long does it take to register with a private insurance, with a private health management organization?
Okay. The list I know of is 7 days. Once you register in 7 days, you'll be activated. The list, but for some, they will tell you this, that for chronic conditions, you won't be able to access care for chronic conditions not until a period of 1 year, 12 months. But you can also see the doctor on primary care conditions, you understand, within that period. But once it falls under chronic conditions, once the patient is having conditions like hypertension, diabetes, or is pregnant, the HMO will not cover for that because there is a waiting period for that. But once you register, the list I've seen is, I think, 7 days. 7 days. Some is 2 weeks before you can start using the service. But for chronic conditions, you have to wait for 1 year.
All right, sir. Okay. Thank you very much, sir, for your responses.
You're welcome.
Okay,
Yeah, that's
thank you
all.
so much. Yeah, thank you, Deborah. Thank you so much, sir. And thank you, everyone that's participated. I think we're beginning to draw towards the end of the program. And I think many people learned a lot from this. I personally, I didn't have like this kind of robust knowledge of health insurance before, especially in Nigeria, but I think I've been able to like at least clarify many of my doubts. And if you still have any question, I think we have about 2 to 3 minutes just to round off now. If you have any questions, please just type it in the chat and we'll get to it. Also, if you cannot ask it here, you can ask on our WhatsApp group. If you're already part of us, you can ask on WhatsApp, you can ask on our website, you can just type it there and we can assure you that answers will definitely be provided to your questions. So thank you so much, sir, Mr. Chukwuemeka. Thank you for honoring our invitation. And just to quickly go over what I said in the beginning, Health Facts, we are a health media company where we give out health information just to improve the lives of Nigerians, in your day-to-day activities, things you need to know. We correct misinformation, things that you think might be right but actually not right. You can join us on HF Live. Is monthly. You'll be able to come here and ask your questions, clarify your doubts. And we had a very wonderful session today, and we usually have sessions like this that are very, very wonderful, where you can just ask anything. Most times people are going to the hospital, you don't have the opportunity to ask questions like this from professionals. Take your time to ask questions and get answers to them. But on events like this, that is just what we're trying to achieve. So thank you so much, everyone that joined in. Mr. Chukwuemeka Uche, thank you so much once again. I'm sure that our audience, they really, really learned a lot from you today. Even personally, myself, Deborah, I'm sure that we all learned a lot. So since welcome. Thank you, sir. And we really apologize for the technical difficulties we had in the beginning. I think towards the end, we were able to resolve that. So since we do not have any questions typed here anymore, like I've said, please feel free to type your questions in our WhatsApp group. In fact, you can also type it on our website. Just go to the comment section, go to HF Live on our website, go to the comment section there, type your questions. We'll definitely communicate your answers to you. So thank you, everyone. Thank you so much for joining. We hope to see you again next month for the next edition of HF Live. All right, thank you, Deborah. Thank you, Mr. Chukwuemeka.
Thank you. Yeah.
Thank you, sir. All right. Yeah, have a nice day, everyone. Yeah. Bye.
Bye.
Bye.